COVID-19 is a viral infection, and like most viral infections, treatment is about comfort and well-being enough while the body heals.
Peter Pan, that's what they call me. I promise that you never be lonely.
Hello once again, I am Lasandra Tiara, and today I was thinking of bringing you a topic to talk about what is happening in our world, in our country, COVID-19. I got COVID-19 last year in November. It wasn't really pretty, but I just thought to myself I should come and sensitize a few people out there about COVID-19 and what you should really do to actually fight it while you get it. The most common symptoms of COVID-19 are said to be fever, dry cough, and tiredness. Less common symptoms would be aches and pains, sore throats, diarrhea, headaches, loss of taste and smell. I got the loss of taste and smell at my time. And the serious symptoms are difficulty in breathing, chest pain or pressure, and loss of speech or movement. On average, it takes about 5 to 6 days from when someone is infected with the virus for the symptoms to show. However, it could also take up to 14 days. The most important thing about using over-the-counter medications to treat COVID-19 is that most of these common drugstore products are not actually going to treat the virus. But these medications can make you feel a whole lot more comfortable while you are sick. And we know that not all patients of COVID-19 require a hospital admission. Identifying treatments that can be used to speed up recovery and reduce hospitalization in the community is critically important, practically among older adults and people with comorbidities who are at high risk of adverse outcomes. And now I present to you a few of the medications that I used while I was fighting for my life with COVID-19. This actually sped up my recovery and gave me a lot of comfort while I recovered. Number one, Axinthromycin. When I was diagnosed with COVID-19 last year November, I was told to take Axinthromycin for 5 days. Axinthromycin is said to have a macrolide antibiotic with antiviral, anti-inflammatory, and antibacterial properties that seems to be a good treatment. Axinthromycin has also shown to have an antiviral activity against other RNA viruses, anti-inflammatory properties, antiviral effects within the bronchial epithelial cells. Axinthromycin has also shown efficacy as an add-on treatment for reducing asthma exacerbations pertinent to the pro-inflammatory pulmonary conditions in COVID-19 progression, and may even prevent or treat bacterial co-infections in patients with SARS-CoV-2. So if you feel any throat irritations or upcoming cold or soreness, start this treatment immediately. Number 2, Zinc. Administering zinc supplement to COVID-19 patients with low levels of this element may be a strategy to reduce mortality and recovery time. At the same time, it could help prevent risk groups like the elderly from suffering the worst effects of the disease. Interestingly, most of the risk groups described for COVID-19 are at the same time the groups that were associated with zinc deficiency, as zinc is essential to preserve natural tissue barriers such as the respiratory epithelium, preventing pathogen entry for a balanced function of the immune system and the redox system. Finally, due to its direct antibody properties, it can be assumed that zinc administration is beneficial for most of the population, especially those with suboptimal zinc status. Our number 3 is vitamin D3. Vitamin D status is related to the risks of influenza and respiratory tract infections. Vitamin D has a direct antiviral effects primarily against enveloped viruses, and COVID virus disease has had a high mortality rate and impacted the whole population of the planet with severe acute respiratory syndrome, the principal cause of death. Vitamin D can adequately modulate and regulate the immune and response to infections with COVID-19. Therefore, maintaining appropriate levels of vitamin D throughout supplementation or natural methods such as sunlight on the skin is recommended for the public to be able to cope with the pandemic. Number 4, vitamin C. Vitamin C, also known as ascorbic acid, is a water-soluble vitamin that is thought to have beneficial effects in patients with severe and critical illnesses. It's an antioxidant and free radical scavenger that has anti-inflammatory properties, influences cellular immunity and vascular integrity. Because SARS-CoV-2 infection may cause sepsis and acute respiratory distress syndrome, the potential role of high doses of vitamin C in reducing inflammation and vascular injuries in patients with COVID-19. Zinc and vitamin C are not bad for you, but they've just not been proven to make you better either. If you want to take some zinc and some vitamin C, go for it. Just please don't assume they're going to keep you from getting sick. Number 5 that I personally recommend is ORS, or oral rehydration salts. ORS is an over-the-counter drug composed of a combination of glucose and salt dissolved in water to rehydrate a patient. Hydration is one of the most important aspects of our human health, especially when the body is faced with challenges such as extreme heat or illness. Good hydration goes a long way in supporting the body's natural ability to defend and repair, which is going to be incredibly important for anyone suffering with COVID-19. Because some symptoms include vomiting and diarrhea, this will come as a good way to hydrate the body, preventing dehydration. Number 6, and most commonly known, is the concoction of ginger, red onions, lemon, honey, and garlic. These above mentioned ingredients will certainly not cure you from COVID-19, but will strengthen and boost your immunity. In a pan, add around 2 cups of water, add ginger, garlic, onions, and honey. Let the mixture boil for 5 to 7 minutes. Strain and serve in a glass. You can add a dash of lemon juice to this as well, since it's a good source of vitamin C. This drink will soothe your throat and help fight cough and cold. Number 7, and the most overlooked, is exercise. When I was done with COVID-19, exercise pretty helped me a lot more than anything, because I was exercising my lungs and I actually felt much better, because when you have COVID-19, your lungs actually contract. So with the exercise, it helps you, train the lungs, and it will really make you feel a lot more better. So now I present to you a few exercises that I did during my COVID-19 time, and these exercises really did help. Okay, now we have come to the end of this, and disclaimer, I am not a doctor, but I was presenting to you the the recommendations for mild cases. If you feel you are gasping for breath and you feel you are in critical condition with this COVID-19, you need to immediately visit the nearest medical center immediately. So I come to the end and thank you. If you really like my content, please like and subscribe for more better content. Thank you.